Hello, and welcome to the start of the 2020 AER conference. We're delighted you could be online with us this year for this event. While we wish we could see you all in person, we have a great lineup of session and networking events spanning the next few weeks. Before we start today, I just want to go over a few housekeeping announcements. A reminder that all conference content can be found on our online platform. This includes links to streaming content, on-demand sessions, session materials, and much more. You must be logged into this platform in order to access all content. If you experience technical difficulties during the event, please review the help desk page on our online platform to see if you can troubleshoot the issue. We also encourage you to review the technical requirements section of our conference attendee homepage to make sure your system is set up properly. Also, feel free to chat us with any issue you might have. There are many ways to engage in sessions during the event. We encourage you to use the discussion tab to comment with each other, our speakers, and our staff. And please use the questions tab in order to submit questions directly to our speakers. And finally, we'd like to thank our event supporters and exhibitors for their support of this year's online event. Please make sure to visit them in the virtual exhibit hall to learn more about the products and services they provide. Some vendors are also participating in video chat and giveaways. We especially want to thank our event supporters, our Diamond supporters, Advara, iMedris, and WCG IRB, our Platinum supporter, Tech Software, our Silver supporters, Cayuse and Prime IRB, and our Bronze supporters, the City Program and WCG IRBnet. And with that, I'd like to turn it over to PRIM&R's Executive Director, Dr. Elisa Hurley, for opening remarks. Thank you.
Thanks, Mary Ellen, and hello, everyone. As Mary Ellen said, I'm Elisa Hurley, the Executive Director of PRIM&R, and on behalf of my colleagues, I want to welcome you to our 2020 AER virtual conference. I know we all wish we could be meeting in person. Nobody wishes that more than I do, but I'm so thankful that we've been able to come together and connect, even in these uncertain and challenging times. Before we jump into this morning's opening general session, I'm going to take a few minutes to extend our thanks to some of the contributors who've made this meeting possible, and then share some of my reflections on lessons from research from this extraordinary year. First, I want to thank the Association of American Medical Colleges for their ongoing support of this conference. We're so appreciative of them to have them as a partner. I also want to thank our supporters and exhibitors for their sponsorship. I encourage you to visit them in the virtual exhibit hall throughout the meeting and to tune in to their presentations. Next, I'd like to thank our conference planning committees who collectively put so much time and energy into creating the agenda for this meeting and then helping to adapt it to this virtual format. They were led by core conference planning committee co-chairs AJ Allen and Elizabeth Buchanan, workshop and didactic subcommittee co-chairs Michelle Feiga and Megan Kazmatis Singleton, and poster abstract subcommittee co-chairs Emily Anderson and Warren Capel. There would be no AER conference without this unbelievably dedicated group of volunteers. I also want to give a big shout out to our speakers, both those who are presenting live and those who pre-recorded their sessions. We appreciate their flexibility and patience, their participation in rehearsal calls, and their willingness to learn new strategies and technologies. The work that everyone's put into making this meeting a success demonstrates what a remarkably generous community this is. And speaking of success, I want to congratulate the winners of this year's Pillars of PRIM&R Outstanding Poster Award. The award, given in honor of founding members of PRIM&R, known as our Pillars, recognizes outstanding projects that are designed to improve animal care and use and human research protection programs through innovative education, tools, procedures, and practices, or that contribute to empirical research or scholarship in research ethics. This year, we selected a poster titled Variation in Interpretation of Subpart B Conditions by Stakeholders in the IRB Review Process of Abortion Research, United States 2019, which was submitted by Jessica Blackburn, Roger Rochat, Lisa Haddad, and Sarah Cordes of Emory University. Jessica has recorded a presentation on the poster project on behalf of her colleagues. You can view the presentation as part of any of the scientific poster panels on the agenda. A big congratulations to Jessica and her colleagues on this achievement. And lastly, by way of announcements, I want to encourage you to visit the PRIM&R booth in the virtual exhibit hall to learn more about PRIM&R's programs. You can explore resources in the booth at any time or stop by between 3 and 4:30 p.m. Eastern Time each day of the conference to video chat with our staff. It's been an extraordinarily challenging year. The coronavirus pandemic continues to have a profound practical, regulatory, and ethical impact on the research enterprise. At this point, we don't yet know what the long-term implications of the pandemic are for human subjects research. When I was at this podium a year ago, I shared some thoughts about the Belmont Report at 40 and about the evolution and flexibility of the Belmont principles of respect for persons, beneficence, and justice in the face of changing circumstances. As we approach the close of 2020, I've been thinking about how the pandemic, together with the Black Lives Matter social justice movement, has shown new and I would say welcome light on the principle of justice in research. People talk about how the murder of George Floyd at the hands of police last spring occasioned a long overdue moment of reckoning in this country about our legacy of racism and racial injustice. I think 2020 is also presenting a kind of moment of reckoning for the research enterprise and its own role in perpetuating or benefiting from that injustice. We in the research oversight field have an important opportunity to examine not just our research practices, but also the ways in which the research enterprise is embedded within a society that is in fundamental ways unjust. We all know that the novel coronavirus is disproportionately affecting people from racial and ethnic minority groups. Black people make up 13% of the US population, but represent about 21% of the deaths from COVID-19. A recent study out of Stanford University found that Blacks and Hispanics account for 58% of COVID-19 hospitalizations and 53% of deaths. According to the CDC, Black Americans are dying at 2 times the rate of whites from the virus. Hispanics and Latinos are almost 3 times as likely to become infected as whites. And American Indian and Alaska Native people are over 5 times as likely as whites to be hospitalized for COVID-19. These are, of course, just the most recent manifestations of long-standing health inequities in our country. We also know that these are the very same groups who are historically underrepresented in clinical trials. Treatment and vaccine trials for COVID-19 are no different. By some accounts, only 3% of coronavirus vaccine trial participants are Black. Although I should note that according to Moderna, volunteers from communities of color make up about 37% of their vaccine trial, whose early results were announced a couple of weeks ago, a figure to be applauded, I think. In other words, and again, this isn't news, many of those who are most at risk from the virus are not represented in treatment or prevention trials. The problem then is that the findings of these trials may not be generalizable to those who could most benefit, and this may in turn actually exacerbate health inequities. These are the bleak and familiar facts. The pandemic and this year's racial justice movements have brought these inequities, along with the range of social, economic, and other factors that contribute to them, into really stark relief. But precisely because they've done so, they also, I think, present us with an opportunity to reconsider justice in research. Conversations are already happening about how the pandemic and the creative ways the research community has adapted to it are helping us rethink how we conduct, oversee, and regulate research to make research participation generally more accessible and equitable. Some examples include the increased use of telemedicine study visits, remote auditing and trial monitoring through use of electronic health records, further development of remote consent processes, and the use of wearables for data collection during studies. All strategies that might support the participation of previously underrepresented groups. In addition, the Multi-Regional Clinical Trial Center of Harvard at Brigham and Women's has recently released an extraordinarily comprehensive guidance document and toolkit outlining how research stakeholders, including IRBs, can help achieve diversity, inclusion, and equity in clinical trials. The culmination of the first phase of a project that has been in the works for several years, these tools could not have come at a better time for the research community. MRCT's guidance and toolkit covers everything from strategies for partnering with communities and research workforce development, to considerations for data collection, reporting, and analysis, to eligibility criteria and subject recruitment issues. The FDA has also just published its final guidance on enhancing diversity in clinical trial enrollment, using the voice and leadership of the agency to encourage the broadening of clinical trial eligibility criteria and other inclusive trial practices, so as not to unjustifiably and unjustly exclude individuals from research participation. And SAGHARP has recently taken up consideration of the role of justice as an ethical principle in the common rule and is examining how it can provide more guidance to IRBs about operationalizing justice concerns. So these are just some of the exciting, important current efforts to identify and implement meaningful steps within the research and research oversight enterprises to make them more just. The twin crises we face this year are also forcing us to confront in new or maybe starker ways the extent to which the research enterprise is embedded in a society itself characterized by various forms of injustice. For example, we are more aware than ever of the extent to which inequities in COVID-19 outcomes are products of social determinants of health. Factors such as whether and where one is employed, whether one lives in close proximity to others, takes public transportation, has access to regular health care, speaks English, has insurance, or has childcare help, to name just a few. The pandemic has also drawn attention to the fact that many of these very same factors also serve as structural barriers to research participation, even for people who might otherwise be willing to participate. At the same time, the lack of representation in COVID-19 clinical trials has also once again made plain the continued legacy of distrust in the healthcare and research enterprise among Black Americans and other racial and ethnic minorities, given historical wrongs perpetrated on these communities. And we can really see this effect in data about willingness to take a vaccine. Just last week, a new study was released that illuminates this trust gap, showing that just 14% of Black and 34% of Latinx people trust that a vaccine will be safe, and 18% and 40% respectively trust that it will be effective. Less than half of the African Americans included in this survey said they would definitely or probably get the vaccine. A recent article in the New England Journal of Medicine by Warren and colleagues suggests that the way to address this distrust is for the research enterprise to take steps to become more trustworthy. For instance, Black people may be more willing to enroll in vaccine trials if they have assurances that Black communities will have fair access to vaccines once they become available, where fair access means they'll be prioritized given the disproportionate effect of the pandemic on them. The developments of this year have also forced us to look at how implicit bias, that is, attitudes and stereotypes we all carry around that affect our understanding, actions, and decisions in an unconscious manner, plays out in the research context, for instance, in recruitment practices. They're also giving rise to important conversations about the lack of diversity in the research workforce, especially the underrepresentation of PIs of color who might counteract recruitment biases and enhance trust in the research enterprise generally, and in specific research projects in particular. Now, these issues aren't new, and they certainly aren't simple. Some of them, such as access to insurance, priority access to vaccines, and increased funding for PIs of color, are clearly outside of our ambit in the research oversight community. Addressing them is going to take larger structural changes. But I think there's value in being clear-eyed about the multiple ways that injustice infiltrates and affects the research enterprise. And I'm hopeful that, unsettling and difficult as this year has been, we really are at a turning point, not just in terms of our collective recognition of the problems of injustice in research, including how inadequate the attention paid to the justice principle has historically been, but in terms of our collective will to take action to address these problems. There's no doubt we have a lot of work to do, but as my colleague Barbara Beer has recently put it, the community seems, perhaps more than ever, motivated and ready to do the work. And PRIM&R stands ready to help. Conversations about these topics and how we might move forward are going to be happening all across the conference. On the screen is a sampling of the intensive workshops, plenaries, breakout sessions, and virtual roundtables that will take up the themes of diversity, inclusion, equity, and justice in research, including our opening general session that's going to start in just a minute. You can find these sessions by going to the conference agenda, clicking browse by target audience, and selecting diversity, equity, and inclusion. We hope you'll join the conversation. So with that, I want to thank everybody for tuning in and for being part of this remarkable community that's willing to have such conversations. I'm looking forward to when we can all be together in person again. But in the meantime, I hope you enjoy this meeting, and I encourage you to complete the conference evaluations and let us know what you thought. Your input really is invaluable to our planning, so I'm going to thank you in advance for taking the time to provide that feedback. And now I'll turn it over to Jada Bussey-Jones, the moderator for our opening general session, Clarifying the Myths and Challenging Bias About Race in Research Review.